Hello and welcome to the third of 4 educational mini-series provided by the Berks County Area Agency on Aging. My name is Barlet and I'm the Manager of Community Outreach and Education for the agency. Our third series in this 4-part series is on getting healthy and staying healthy. And today's segment of that series is how does lifestyle influence our health? And my guest with us today is Dr. Paul Brockman. He is a physiatrist, and that's a tricky one to say, a physiatrist with Reading Health Rehabilitation Hospital. So thank you, Dr. Brockman. I appreciate your time and your expertise and sharing some important information in today's topic. We're going to start again with, all encompassing our getting healthy and our staying healthy. We've had already talking about healthy eating and nutrition. We've also had Dr. Weiss in the physical therapy department at Alvernia University talking about the muscles and how that works and functions and trying to work those and stay healthy. And I think our program goes right into the next phase and parts of that today. So I'm going to first start with, before we get into that, if you can just give us a little explanation of the area that you are the physiatrist. What is physiatry?
Physiatry is a branch of internal medicine and has to deal with function and quality of life. A lot of people call that physical medicine rehabilitation. So I work very closely with physical therapists, occupational therapists, speech therapists, and a large component of what we do to help people in terms of recovering function relates to exercise and activity.
Okay. I guess we all need a physiatrist, and I think that's what we'll find out today. So we're going to start with why and some of the major health issues, and we've got some health issues that are happening today that may have changed over time. So let's talk about right then. We've had some period of time where things have changed over 100 years. I know we've been active in the past and not so active now. So how has our health problems changed over time? Have you seen a change in those?
There's been huge change of our general health and our health-related problems over the last, particularly 100 years. A lot of the information that I'm going to quote to you is from a lot of the articles from the Mayo Clinic that has done extensive testing, evaluation, and summaries on this. Their understanding, or their best explanation to understand how our bodies have evolved, is to think that we evolved over about 2.6 million years to about 10,000 years ago as evolving into being hunter-gatherers, where what we did, we spent our entire days walking, looking for food. We would get nuts, berries, fruits, vegetables, and we'd occasionally kill something and get lean protein. And that was sort of how our bodies developed to live in that environment. After 10,000 years ago, civilization started and became more of an agricultural setting. And for the last 10,000 years, we've been largely agricultural until about the last 150 years, where we've become industrialized. And we've gone from being working in the fields, active most of the day, to living in cities. And with that, major changes in our physical activities have occurred. And when you look at it, particularly in the last 25 years, we've gone from an industrial nation, which still had physical labor as a major portion of those industrial jobs in farming, to being in the last 25 years very technology-oriented. And in that setting, our physical activity significantly decreased. Where now they see that for the average person, they probably are sedentary or sit on about 60% of the day. They're spending probably a little over 30% doing light activities of getting up and moving around, and then they spend only about 3% of the day doing physical exercise, vigorous activity. And with that change, our bodies have significantly changed, and it's had a huge impact on our health problems.
Well, and I think even as you were saying some of those things, it was natural when you were out in the fields, you were physically active, that was part of your day. Now, our day, we have to schedule a piece of our day to actually concentrate and take the time to do something physical, right? So we've seen that as part of the change.
Yeah.
Okay. I guess one of the things that, so obviously, let's just ask, you mentioned sedentary. I think I have a slide, so if I can find that slide for us. Okay, no wait, let me find that slide. And I think what as you mentioned, it would be something that would be how physical we are, how sedentary are we. So there we go. All righty, I think we can get that up on the screen now. You talked about we've had decreased physical activity with age and probably over time too, in terms of the activities that you mentioned.
So as we get older, it's like a double whammy in that we have this cultural change where we become much more sedentary as a whole population at all ages. And now we also look at the people as we age, that it becomes more profound.
Okay.
This graph represents looking at activities for men and women as far as how their physical activity has decreased with age significantly. So it becomes a bigger problem as we're sedentary through our whole lives and start developing some of these chronic illnesses, but then it's even compounded further as we get to our 60s and 70s where we become more sedentary.
Okay.
And so that in a person as they're older, these problems are even made worse.
Okay, so looking at that, then I think my next question is, and I'm going to also flip back up then, how, in terms of then, we've talked about the physical activity or sedentary, being sedentary over time. And so our topic is getting healthy and staying healthy. So let's look at the chronic conditions and, you know, how, what kind of major health issues and chronic conditions might we have, and how has those health problems or those conditions changed over time?
Yeah. Now, what is interesting is that when they review the major health problems that affect people in general, they know that 60 to 70% of them are directly related to lifestyle. It's not communicable diseases. It's no longer infections. It's no longer things that you would get as far as an illness, like an acute illness, like an infection. But it's more things that are related to how we live, what we eat, and what we do. And those major chronic problems include heart disease, high blood pressure.
We have another, we can have that put up while you're talking about it, if that's okay on the slide.
So this is just the list of these chronic illnesses that are directly related to our major problems that we deal with, and they are heart disease, stroke, peripheral vascular disease, and those all have to do with circulation through our body. Cancers are directly related to problems that we have with obesity and what they call pro-inflammatory states, where when we're sedentary and have additional fat deposits, that it triggers more inflammation in our system and raises the likelihood of developing cancers, particularly breast cancer, colon cancer, GI cancers, not so much the head and neck and lung cancers, which are smoking related, but all the other ones, GYN cancers, are all linked more to sedentary lifestyle and obesity. Obesity itself has been a huge problem, where now they estimate about 68% of our general population in the United States are overweight to obese. And what really scares us is when we look at the children coming up, we're seeing that trend becoming progressively worse. When we compare to the number of adolescents who were obese 25 years ago, we're seeing significantly more of that. And we see that those habits or those patterns that develop during adolescence and into early adulthood continue and compound into adulthood and as we get older. So the other things that are mentioned here, diabetes is a problem where our body becomes resistant to insulin, again directly related to having excessive fat cells. There's abnormal lipids, the cholesterol medicines that so many people are taking. There are concerns with hypertension. Arthritis is directly aggravated by weight. If you can lose 10 pounds, you can decrease significant amounts of forces across the knees and decrease knee pain. There's issues with osteoporosis related to inactivity and lack of exercise. And there's really good data showing that depression and dementia are significantly more common in people that are sedentary. So those are the issues that are huge issues that confront us in today's environment. And these are the major cost drivers. And when we think about it, the expense of our medical care is really excessive. I mean, it's a horrendous problem that we all are getting impacted by.
And it seems like all we're doing is trying to either take a medication for this chronic condition, arthritis, osteoporosis, helping to lower this and lower that, and without maybe adjusting obviously our lifestyle. And if we're acknowledging that we are more sedentary, then obviously if we balance that the other way and increase some activity, physical activity, exercise combinations, then it may tip it back so we have less costs for those items, and our health and chronic conditions may get better. And then it was something that you mentioned just a minute ago, was that as you can see with the teens, even the changes from the young kids to today, and in today with teens, and we're seeing all these chronic conditions, and then think about what their lifestyle is and how sedentary they are compared to in the past. So I think that moves into how does then our lifestyle influence our health, and the more, why are we, we've gotten sedentary, why are we so sedentary? We've talked a little bit about the changes and that we aren't doing the out in the fields as much, and more is technology and some other things that would come to mind.
Now there is a slide that we may be able to find that shows when we think about our activities throughout the day, we need to break them down into compartments. Obviously we sleep part of the day, and that doesn't count. We're talking about waking hours of activity, and basically when you think of what we do now, we're up for certain periods of time awake. Sedentary means basically you're either lying down or sitting, and so that when we think about what we do at work, for most of us, we are doing sitting activities almost continuously at work, and not a lot of opportunity to get up and move. And so that's a huge factor. When we come home, it used to be that we would, and this would be for our kids and for us, we used to walk to school significant distances. We used to have to walk distances to get to work. Since most of us use cars in Berks County for transportation, when we're in the car, we're sedentary, we're sitting, we're not using muscles. And for many people, particularly if they commute a distance, they may be in the car for an hour or two a day just sitting. And that is another activity that's sedentary. When we come home, the tendency is to think, oh, we've got to sit down and relax. And if you've been sitting all day and traveling in your car all day, and then you come home at night and you sit down and relax in front of the TV, or looking at video games, or looking at any of the entertainment things that we have now that are all digital, that feeds into more sedentary activity. And so that does not, in our normal daily life, we don't have a whole lot of just automatic movements where we used to be automatically moving and walking. And the striking thing is that to have the health benefits from exercise and activity, you don't have to be running marathons. Really, we see that just getting up and moving and changing position every opportunity you have has a positive effect on improving the metabolism and really doing things to prevent you from being getting the chronic problems that you have from heart disease and diabetes.
Okay. So do we want to look at perhaps the next slide of being sedentary worsens the concerns of aging? And go to that one. Okay. Another one is again how that sedentary worsens the health concerns, and we just kind of, let's review that again then.
So the way to think, I think about, when we think about aging, and particularly we saw before in the graph that as we age we tend to be more sedentary. If we have already lived a lifestyle of being sedentary throughout our whole lives, number one, it's very hard to change our behavior. And we have developed these problems along the way that are compounded by age, the effects of age. So a lot of these problems that we say, oh, sedentary lifestyle is a problem with it, those are the same exact problems that we get with normal aging. So the two of them together are like an additive effect. So we see this whole concern about increased body mass index, meaning that you increase the composition of your body's fat to muscle ratio. And so that with that, you see typically the type of obesity we worry about the most is what's called central obesity, where you see increased abdominal girth. And that the concern there is that it seems like the fat deposits around our internal organs seem to be more directly related to the significant health problems we have, like diabetes and lipid problems and blood pressure and the morbidity that goes along with those problems. So we frequently don't think that the weight itself frequently is maybe not the top priority, is not how much you weigh, but somewhat the distribution of your weight, and also more importantly, how active you are. And there's all sorts of good studies showing that people, if they're overweight and are physically fit, their risks of these health problems are the same as a normal weight person. So it's more how fit you are, and so that a lot of people get fixated on, I've got to lose weight, and it doesn't have to be that. You have to become physically active to see the benefits as far as the decreased risks of these health problems and improving muscle and bone strength.
So obviously, you know, again, I always think of it as a balance or a scale. So you've just said that being sedentary, we know with the lifestyle that we have currently, that changes over time, can worsen our health concerns. We've seen an idea of some of those more common, I guess, chronic diseases that are affecting us, and looking at, you know, I guess what I'm looking at is focusing on particularly seniors. I mean, younger folks, you know, if they're listening and learning some of this, they have some extra time to kind of get into a natural groove of adding some regular physical activity and exercise. And some get that in the schools when they're participating in things. But now if we're focusing on seniors and how do we add that even in ours with those of us who are working, or some into retirement who are working, or even beyond retirement, you know, how do we somehow get what physical activity, exercise, and what that is, you know, physical activity versus exercise.
Now, a lot of people sort of are confused about what the difference is. And the way to think of it is, you know, physical activity is generally just movements, changing position, doing things, and it's frequently functional activities, like you're doing the laundry, you're working in your garden. And whereas exercise is a subgroup under that, a smaller group. If you think of exercise as being a more structured form of physical activity, usually with a certain target. Like if you're exercising for a sport, your target is to perform that sport. If you're exercising to lose weight, you may be trying to deliberately use large muscle groups to burn up more calories. If you're exercising to improve your body image, there might be certain groups that you work on. So that exercise is really just physical activity that is more targeted, that is focused on a specific goal that you set. And then the studies all show that if you target and work on these things, again, persist, you can achieve these goals, depending on really what's important to you to achieve.
Okay, so I guess in looking at that then, you mentioned the differences. Can we look at some of the health benefits then?
Yeah.
All right, and I think I'll try and find the slide. Oh, here we go.
We
got some health benefits, and a lot, obviously, it's a full slide of health benefits of physical activity.
So if you look at this slide, it does go over a whole multitude of things, and these are the main things that we are trying to do for our general health. And again, as we age, these health problems accumulate and grow, and so as we become older, you know, these are things that become more evident to us and become much more of a problem. You know, usually early on when you're young, your bodies have an amazing ability to compensate, that you can get away with certain things and other systems can compensate. But as we get older, that amount of sort of a safety zone of what is wrong with you that doesn't really affect what you can do becomes less. So that when we think about it, the benefits for the exercise and physical activity, the cardiorespiratory benefits are tremendous, related to better perfusion, better functioning of the heart, more efficient muscles, decreases your likelihood of having heart attacks and strokes, and it also decreases your likelihood of dying. They estimate that when they compare a person who is 70, who is physically active, compared to a person who isn't, their expected life expectancy is about 1.5 to 2.7 years longer at a given age if you're physically active. So it has a direct impact on how long you live, and more importantly, it has a direct impact on your quality of life while you're living. If you're physically mobile and independent, generally you're being able to do the things you want to do, you're visiting with family, you're not limited as far as bed bound, you're not at risk of falling and injuring yourself, you're not as likely to be institutionalized and require care. Being independent and not being a burden to our families is, is a big concern and something that everybody really cares about. It's unfortunate that sometimes we wait until disaster hits before addressing it. It is interesting that a lot of people unfortunately have to develop a critical health problem before they suddenly really the light bulb goes off that they say, I've got to do something proactively to decrease it, whether that's a heart attack or a stroke or a total knee replacement or a cancer. All those things are motivators because the person is sort of slapped in the face that they've got to do something, and they realize that they can do something. It's not just the doctors curing them or fixing them or patching them up, but they can actually do something themselves to take control.
I know, and I'm glad you said that, because I was just thinking, I was looking at the health benefits and looking at some of these on the list, reduce pain, stiffness, and fatigue. And I hear this little, voice inside my mind, and some of the folks working in another arena that I also work in, and we're standing a lot physically in one spot. We're going up and down steps, and I've got some patrons who are coming up and down the steps, and all I hear, I have to just tell you, is we're all going, oh, this ache and this pain. Oh, the steps seem to get longer each night. And reverse that, if we could only get that understanding that it's reverse, and that although I have the aches and the pains, it's not coming from me walking the steps. It's actually from me in my off time not doing anything and just kind of being sedentary and choosing, I'll do the physical activities that you mentioned that are typically part of your day, but combining that with the other non-active lifestyle. And then our activities that we do enjoy is sitting, watching a sporting event, sitting and watching something and reading something. We're getting the aches and the pains from being sedentary and then trying to do that one particular thing. So let's look at then what I'd like to talk about is, obviously we want to look at moving from there. Give us the motivators. What motivates us? How can we get motivated? How can we understand that we can get healthy and then help us to stay healthy? What can we do to reverse that thinking as, oh, it's just aging, I'm getting old, I'm sitting around? How can tell me how I can be motivated?
Another slide. If we
Okay.
jump, there's a slide I think that talks about things that different people find as motivators and obstacles, because that's always what we're dealing with when we're trying to start an exercise program when you're not really used to doing exercise as a regular part of your lifestyle.
And you're all, oh, I have to exercise, and it seems such a concentrated, I've got to do this, and it seems more overwhelming than it necessarily is.
Now, we'd mentioned before that sometimes the motivator is an acute illness, and we talked about that as sort of the slap in the face that some people would get that motivates them to take action. But there are lots of other motivators, and the funny thing with motivators is what may be a motivator for one person is an obstacle for another. For example, appearance. One person may be motivated because they want to change their appearance so that they can wear a dress or go to a wedding or some special occasion. Another person, the whole issue of appearance makes it so that they don't want to go out in public and be physically active. A lot of when we think about why we don't do walking, some people don't do walking because they don't feel that they have a safe place to walk. That if they don't feel comfortable in their neighborhoods or trying to go somewhere where they can walk where the temperature is comfortable. So it's funny how different things are motivators and obstacles for different people. Again, a lot of us are driven by wanting to be independent, and wanting to not be a burden to others. And unfortunately, we almost have to get to the brink of being dependent before that occurs.
Kind of like that light bulb.
Yeah. And it is frustrating because, again, we all worry about expense. The medical expense, just when you get your bill from going to the doctor's office or to the hospital for any kind of procedure, it is mind-boggling how expensive it is. And we know that interventions early on, being proactive, trying to act before you need to have the major surgery or a major event occur that you get into trouble, is very low cost. And yet our system, and I'm sort of blaming the healthcare system, is so targeted against the dramatic interventions in states where the person is in crisis. So we tend to be more of a technology crisis-oriented medical system and not so much one that is a proactive, preventative. There's very little things in our system that really encourage people or reward people for a good lifestyle to prevent from getting this position. And yet when you look at the cost to everyone, to society, being proactive is what we need to do.
And I will tell you that one quick thing you had mentioned about falling and the prevention. One of our health evidence-based programs is called Healthy Steps for Older Adults, and it's a fall prevention program. And one of the things on your motivation obstacle thing is the desire to live longer or to be independent and healthy longer. And that's really one of the things that when we present that program and determine their risk for falling, it's not just, okay, your risk for falling is this, do a couple of these things. It's you want to stay where you are, doing what you're doing independently. Nobody wants anybody to have to come into their home and help them do daily activities so they can maintain. And if we can prevent, with some education, the prevention of the falling, the broken bone and the rehab and all those medical expenses,
the osteoporosis
and the feelings of all of that, but again, as you mentioned, it's unfortunate that sometimes the fall, we need to have that event. In the little bit of time that we have, because we could be here, much longer on this whole topic. So if we were, how physical activity and exercise and how that's important to our lifestyle and how over time we've had a sedentary lifestyle, I guess I would say then, what can we do now, whether it's right now, today, at no matter what age we are, young or old, to kind of improve the health, which will improve our medical conditions.
I think that your approach has to be, you have to look at yourself and say, where am I now? Because you have to start where you are, know what you can do. You have to ask yourself, what can I use? What do I have that I can use and do? And you start at that level, so you start where you are, and then you do the best you can. Now you look at your individual environments, your home settings, and you look for every opportunity you can to get up and move. I tell patients, every time there's a commercial, if you watch TV, I want you to get up and move around. Or when you go when you eat your meal, I want you to take 3 laps around your house, or be on a daily basis trying to work to get out and take short walks and gradually build on it, with the ultimate goal of being able to walk about 150 minutes in the course of a whole week.
Okay.
So whether that's 5 times a day for 30 minutes, or whether it's walking for 10 minutes 3 times a day for 5 days, you can break it up any way you like. It's an additive process, meaning that when you exercise, even if it's in little bits, it counts. So that you can, if you do lots of little bits, that will give you the same benefit of putting together a whole bunch of time.
Well, that's all the time we have for this segment. I'm pleased that you were with us today, Dr. Brockman, and could share with us the importance of getting healthy and staying healthy and improving our sedentary lifestyles and ultimately our health and our health conditions. Thank you.